Hi everyone, this is Janae Cherie. Welcome to my channel. It is 3 days since I had my double mastectomy and I wanted to check in with everyone. It has been quite the adventure, a very painful adventure, admittedly. Um, I got home from the hospital on Monday. I'm sure you saw my recording from Monday night. I was actually feeling pretty good, like top of the world. And then I went to sleep and and then I woke up Wednesday and Thursday and this morning. Definitely not on top of the world. So in terms of pain, I would say pain is pretty high. There's a lot of restrictions, so I can't get the bandages. I don't know if you can see the bandages. The bandages are under the shirt here. I'm not allowed to get the bandages wet until the 31st, which is when my appointment is with the doctor to hopefully remove the tubes and change out the dressings. So it's sponge baths for me. So I've tried to remove all the pen from my neck. I put on some makeup to come say hello to all you people to make sure I look a little bit fresh. But it's definitely been a challenging couple of days. It's been very hard to muster up the energy to do anything. Especially the last 2 days. So I was given oxycodone and gabapentin. And just to be clear, nothing I say here is medical advice, recommendations, anything else. Talk to your doctor about your own pain management situation. But I specifically am non-responsive to most pain medications. And what that means is that most pain medications, when I take them, they don't do anything, which is fabulous. I learned this for the first time about 2014. I had an ankle surgery and I was sent home with Norco. And I knew Vicodin didn't work, and I had told my doctor Vicodin didn't work. And what he did was he sent me home with Norco, which is essentially just a stronger version of Vicodin. And it didn't work, and I ended up calling him screaming and wailing in pain at 2 a.m. saying, "What did you give me? I need pain medication. This doesn't work." It literally did nothing for me, which is crazy because I hear all these people talk about how Vicodin and Norco are their best friends in the world and how they'll take it anytime. And I'm like, give me Tylenol. It's better. It does more. And literally that surgeon gave me Tylenol with codeine and it did a far better job, admittedly a small job, of taking away the pain compared to the Vicodin and Norco. So ever since then, I've known that I'm non-responsive to certain medications. And I had surgery last year with my oophorectomy to get one of my ovaries removed, and I was given oxycodone, and same situation. It didn't take the pain away, but it did take the edge off. So I told my doctor that for the double mastectomy, I said I had an okay experience with oxycodone last time, not nearly as good as my roommate when he had shoulder surgery and he took oxycodone. He was flying high. He was happy to be in the world. He was talking about what a party they were going to have. We were going to have pizza and watch movies and life was great. And he was feeling no pain. That's what I want out of my pain medication. Never have gotten it, ever. But that being said, I did tell my doctor, I said, the oxycodone worked well enough with the oophorectomy. It took the edge off. Do what you prescribe, what you think is best for my situation. And so she prescribed oxycodone and gabapentin as rotating to help with the pain. And whether they take the edge off or not, it's so hard to know. Maybe I have too high of expectations for pain medications, but for the last 2 days, I have been in miserable, agonizing pain. Just everything I do, I'm hunched over. It hurts and so uncomfortable to do anything and to move. And so, yesterday, Thursday, so 2 days after the surgery. So yesterday I called the doctor and I said, can we try something else? This is not working. And so they prescribed me the next medication, which is tramadol. And so my partner picked up the tramadol yesterday, and it's so funny because the pharmacist was telling him, this is not as strong as oxycodone. It's not going to work as well. And admittedly, I think it's working better. I took it for the first time last night, and then I took another pill this morning. It's one pill every 6 hours. Obviously, follow your own doctor's prescriptions and directions on what to order. But I think it's working better. I feel better today than I did the last 2 days. It's hard to know whether that's because the skin's healing and I'm in less pain, or is it the medication, or is it purely psychological? It's so hard to know, but I feel so much better. I mean, I felt good enough to put on some makeup and come say hello to you lovely people. So that's saying something. But it's been quite the challenge. So anyways, that's in terms of pain management. And like I said, I've just had a history of pain medications don't work. It's interesting. I was talking to the nurse at the operating room, and I was telling her about some of my concern with pain management. And she asked, "Are you a redhead?" Well, so as you can see, I'm not a redhead, but I do have some little streaks of red in my hair, which is natural. Everything on my hair is natural. And she says, you know, redheads, they always need extra pain medication. And she proceeds to ask me, she says, when you're at the dentist's office, do you need extra Novocaine? I said, well, yeah, I always need about double in order to numb everything up. Otherwise, I can feel everything. And she goes, that's a redheaded trait. Whatever that genetic mutation or trait or whatever is, apparently I've got the short straw on that as well. And she says it's very common, whether it's that the medication doesn't work or that it metastasizes very quickly through our bloodstreams. Who knows? I'm not a scientist. I'm not a doctor. I'm not sure how that works. But medication tends to not work on me nearly as effectively it does on most people. And so as a result, I do fortunately have a very high pain tolerance, but at the same time, doesn't mean I want to be in pain. And let me tell you, the pain from this surgery has just been awful. So there's scars, obviously, all the way around my breasts, but there's also scars in my left armpit. There's cuts in my left armpit from where they removed the lymph nodes. And so many things make it hurt. So anything that involves my core, where the core tightens, is pulling on that skin. And it's just, so getting in and out of bed. Now, once I'm laying down or once I'm sitting up, I'm fine. But the getting into bed and getting out of bed or sitting down or sitting up, that movement, because of that core strength it takes to move, it hurts so bad. And then lifting anything. So I've been given strict instruction by the doctor. I'm not allowed to lift my arms, my elbows over my shoulder. So I'm not allowed to reach up and do anything. But what I also didn't consider is that putting pressure on anything, it involves that muscle in your arm, and it's affecting all these muscles down here as well, which is pulling on the tissue. So I was trying to get ice out of the ice cube tray, and I was pressing on the plastic to try to get the ice cubes out. And I was tightening this muscle right here. Oh my God, it hurts to get ice cubes out of the tray. And I'm not allowed to lift more than 15 pounds. And I picked up Spaz, my 10-pound puppy dog, because it's allowed. It is allowed. But even just picking him up, that tightening of those arm muscles, and it's just, and then you can't roll over in bed because that just moves too much. It jostles too much. I'm not trying to complain. I'm sure you guys don't need to listen to me complain all day, but it has been an experience. So I like the tramadol. The tramadol seems to be doing much better. So I ended up doing a full WALK today with my roommate, who actually held the leashes while I just strolled next to them. And I was actually able to do the whole thing. Yesterday, I was only able to go about a quarter of the way before I was feeling too much pain from going up and down the hill and walking. So thank goodness for that. It just seems to be so much better. So interesting enough, though, I actually had a scare earlier today. I was on this computer. I was what should have been at a resting heart rate, which for me is about 70 beats per minute, when I realized that my heart was just racing, like absolutely racing. And so I am an EMT, so I know how to at least do some basic self-assessment. And so I immediately took my pulse and I was at 120 beats per minute, which is really high since I'd been sitting for the prior hour. I ended up getting out my blood pressure cuff and I took my blood pressure and it was normal. It was about 120 over 80. Normally I'm 110 over 70, but it's not so far at the range of normal. But my heart was just racing and I realized that I've been feeling faint for the last couple of days and I've just attributed it to the pain making me feel a little bit faint and uncomfortable. But along with the racing heart rate, I said, I'm not sure. Something might be wrong. So I ended up calling the advice nurse and she scheduled me for an urgent doctor's appointment today. And I talked to the doctor and I explained, I said, I'm trying not to overreact. I'm trying not to be panicky. But I was sitting at my computer and all of a sudden I realized my heart was racing at 120 beats per minute, which is really, really high for me. Any thoughts? I just changed from the oxycodone to tramadol. Is that a side effect? Should I be concerned? And the good news is that after we went through 100 different questions, the doctor was not concerned. But one of the things she mentioned is that after surgery, two of the big things you're concerned about is number one, infection, and number two is a clot. And a blood clot can cause things like a racing heart rate, as can an infection. And things to look for, and what I was told to do is keep an eye out for any continued issues. If my heart rate normalized within about half an hour after making the call to the advice nurse, so that's been normal ever since, fortunately. But she also said to keep an eye out for a fever, which could be indicative of an infection. She said to keep an eye out for edema or swelling in the legs, which could be indicative of a blood clot. Any low blood pressure could be a serious indication of an issue. And obviously breathing issues, which could also be indicative of a blood clot in the lungs. And so that was my little bit of a scare today, is having that heart racing issue and not knowing what was going on and feeling like something was wrong. She did say that very possibly it's a result of the pain. Because I've had so much pain can trigger an adrenaline response, which can cause a racing heart rate. So very possibly that's what happened. And again, just she told me to monitor ongoing to see if it happens again or if it changes. And hopefully not. We'll go from there. So I forgot to tell you, in addition to being prescribed the oxycodone and the gabapentin, and now, of course, the tramadol and the gabapentin, I was also prescribed with, ta-da, stool softeners. And the reason I bring that up is so many of these medications they put you on will stop you up. And it's really important to remember to take that so that your body, does what it normally does naturally without any complications. I actually have a really funny story about someone who was not prescribed stool softeners along with some other pain meds, and it created a crisis. Funny story for another time. But with that in mind, I hope that if you are dealing with cancer recovery right now or a mastectomy recovery right now, that you're not having a racing heart rate or any of these crazy complications or questions that I've had, and that you're having a healthy, happy recovery. Share your experiences below, and I wish you the best of luck, and we'll talk soon. Thanks.